people still think that AIDS has to be a death sentence. People are afraid of getting tested because they're afraid of finding out something they don't want to know. The most prominent message that I think needs to be disseminated is that if you're infected today, the lifespan of someone infected with HIV that keeps their viral load to an unmeasurable level by taking their drugs is identical to the lifespan of someone who doesn't have an HIV infection. And that's big news. I'm still surprised how many people think that HIV is a death sentence, and therefore there's no reason to be tested because I'm going to die anyway, so why not go out not having to have this burden for many, many years? And that's completely untrue. A second major issue is that, I can tell if someone's HIV infected, and I'll know. They'll have some symptom. I've seen those people with wasting diseases. I've seen their faces and whatever, and that's absolutely completely untrue. Another potential myth is being afraid of certain ways that HIV is not transmitted. So there's still people who are concerned about, can I really kiss this person? Can I really hug this person? Can I really share utensils with someone with an HIV infection? Am I going to be at risk from that drinking glass? And none of that is true. HIV is transmitted through blood and bodily fluids that you need to get into the body. And that's not by kissing and drinking from a glass or sharing your utensil and so forth. Now, that doesn't mean that you should ignore good hygiene. For example, you shouldn't share razors with someone with an HIV infection. You shouldn't share a toothbrush with someone with an HIV infection. The truth is, I wouldn't do that with anybody, but that's another story. Because it is a potential for something to be on a toothbrush or on a razor, and if you're bleeding in your gums and there happens to be some virus there, I guess it's not impossible that it could get in there. You certainly don't want to get blood or some other bodily fluid on a cut wound on your body, on an abraded skin in your body, because that's just asking for ways of getting this virus into your body. So two other things that are important to talk about is many people feel that if you're in a monogamous relationship, say, and you're both HIV infected, well, then there's no reason to practice safer sex because that person has a virus and I have a virus, so what? We're trading viruses, we're infected anyway. And that's absolutely wrong. The reason is that the likelihood that you have identical viruses is close to zero. Even if you started out getting infected from the same source, let's say a blood transfusion, those viruses may have mutated at different rates. So you don't want to trade viruses from one to another. And that's happened multiple times. So no, you don't want to stop practicing safer sex just because you both have a viral infection. In terms of how infectious are you if you're on effective therapy? Well, this is good news. So if you're taking your anti-HIV medications and your viral load is undetectable, or even if it's just below 1,000, the likelihood that you're going to transmit HIV sexually by needle sticks to someone else is close to zero. It is not zero. It's very small. It's not zero, but it's a very, very low risk, and that's very good news. And it's absolutely not true that if you have an HIV infection, you're going to get AIDS. If you don't take antiretroviral therapy, the likelihood that you'll get AIDS is pretty close to 100%. On antiretroviral medications, the likelihood that we're going to prevent you from ever getting frank clinical AIDS is very, very good. And if you take your medications early and maintain an undetectable viral load and your CD4 counts above 500, the likelihood that you're going to live a normal lifespan is close to someone or identical to someone who doesn't have an HIV infection.